Are you going to mute, Chris?
Hi, guys.
Hey, good afternoon, everyone. Thank you for joining our webinar this afternoon. It might be best if you, so that we can make sure that we're able to get a good recording without any interruption, if you could just turn off your video cameras. I've already muted everyone. So if you turn off your video cameras, we make sure that nothing is freezing, okay?
Just stop it. Okay.
I'm just gonna stop the videos for you. So good afternoon, everyone. I'd like to thank you for taking time out to join us today. To turn on your captions, on the bottom of your screen, you should see a CC button. Just click on that, and that will allow you to turn on the captions. Now, I know many of you might be saying the captions are very small. Next, by the CC button, you'll see like a little arrow pointed up. That arrow will allow you to change your settings. Click on that button where it says subtitle settings. You click on that, you can change the size of the captions. Again, I'd like you to turn off your videos to ensure that we are able to make sure that we have a good feed and that it's not slowed down. I'm going to turn you off myself, but since there's so many of you, if you're able to stop your video yourself, that would be appreciated. So just before we start the webinar, I know that many of you are adjusting to living in this new world that we're currently living in, and social distance is a challenge for many of us. However, CHAW wanted to set up these webinars to enable us to come together and to connect. Today, we are discussing being hard of hearing in a pandemic situation. My name is Christopher Sutton, and this will be my last webinar as moderator as the National Executive Director of the Canadian Hard of Hearing Association. And I have the pleasure today to introduce our speaker, Gael Hannan, which most of you may know. Before we start the session today, I want to let you know the session is being recorded for future playback. It will be featured on the CHAW website, so you'll be able to view it at any time. This is also an interactive session. If you have any questions, you can either ask them in the chat box, and that you can see is located on the bottom of the screen. You just click on that button and you can send a chat to everyone or just to myself or Janice, and we'll make sure that your questions are addressed. We also invite you to send questions to the email address events@ev ENTS@cha.ca, and they'll be answered at the end of the webinar. We all know that the news is full of information about COVID-19. We cannot turn on any news bulletin without learning about how this virus is progressing through the world. How we are dealing with this and how we are getting the information is adding so much stress to our daily lives. For many of us, we have the added stress of not necessarily being able to access communication in an accessible means. Some of it can be very isolating, and social distancing, or as I'd like to call it, physical distancing, is pretty difficult for some of us. The Canadian Hard of Hearing Association thought it would be helpful to have a lighthearted look at living through these tiring times. And we have this webinar today, and in the coming weeks, we'll also be hosting a number of other webinars to ensure that you are able to get more information and to be able to connect with one another. As you should know, Gail is a humorist, public speaker, and writer on hearing loss issues. In her 25 years of advocacy, Gail has created award-winning performances, works, and educational programs that explain life with hearing loss and the tools for kicking down these barriers.
Hey.
We are very pleased.
Yeah, I know. He's been told, I bet.
We are very pleased to have Gail join us today to take on living with hearing loss in a pandemic situation. Thank you, Gail, for joining us. And the floor is yours, and your microphone is muted.
All righty then. Can you hear me? Christopher, is it good? Great. Good afternoon, everyone. And I would like to thank the Canadian Hard of Hearing Association for holding this webinar. And we're able to connect from all around the continent. And I'm talking to you from way out on the west coast of Canada, on Vancouver Island, specifically on the Saanich Peninsula. One of our claims to fame out here is that until last week, or the week before, Harry and Meghan and little Archie were literally living down the street. So we're pretty proud of that. And but they've gone now, and so have all the paparazzi. Anyone who lives with hearing loss knows that we're as good sometimes as the technology. I'm hoping that you're all able to access this webinar so that you can understand what I'm saying. And I know you're either listening on your devices or you're reading my lips, reading the captioning, all of these things. And just understand that there might be glitches, but we're absolutely doing the best we can. Personally, I wasn't able to work a split screen, so my notes are down below. So you're going to see me sort of looking down at my notes rather than looking you straight in the eye all of the time. But so I'm delighted to be here. I got dressed up. I wore my cochlear earrings. Maybe you can see them. And also I have my cochlear tattoo. You see that's my cochlear tattoo. I didn't get that just for today. I had that done a couple of years ago. Anyway, for any Americans who are joining us today, welcome. I just want to let you know that you may see what you think are spelling mistakes, but they're not. It's one of the main differences between the United States, the Americans and Canadian, is that we often put a U in our words, such as neighbor, favor, harbor. So that's one of the main differences. And I don't want to get any more political than that today. If you're like me, I just want to pause here for a moment. I see whether someone's flashing messages at me, they're not. Okay, I'm just going to ignore all those flashing messages. So So if you're like me, you have been glued to the television set quite a bit lately. And in so doing, we've been reminded, some people don't even know the name of our prime minister. Now they do, if they didn't. We also know the names of our chief medical officers across the country, all information that comes because we are watching and glued to the set. Now, I love Prime Minister Trudeau's daily updates, which he does out front of his house. He tells us every day that we need to stay calm, be smart, be safe. And I love that message. And in our house, we also watch a lot of American TV because we want to drive ourselves completely crazy. And I have to admit something to my American friends, is that I have fallen in love with Andrew Cuomo, who is the governor of New York. And apparently I'm not the only one. People are falling in love with Justin Trudeau. They're falling in love with Cuomo, who they call the Love Gov. And I watch his daily updates, even though they're full of the worst news possible. But Trudeau, Cuomo, everyone, their messages we see on TV, on commercials, they're telling us we are all in this together. And that is one of the most important things that we need to remember. If it gets to us, remember, you're not the only person going through this. Other people understand how you're feeling. And the great thing about the television and also some of the websites is that captioning is provided. And now the daily updates also have sign language interpretation. Justin's first briefings did not have that. And the Canadian Hard of Hearing Association was instrumental on getting onto the phone with the Prime Minister's office and making sure that captioning and sign language interpretation was available for all deaf and hard of hearing. So I don't have any new information to share or anything that you might not already know. I'm here to talk about what it's like to go through this pandemic and also to go through it with hearing loss and how does that come into play, things we might want to know. I know we said this is a lighter hearted look and at the pandemic. If you're expecting it to be really funny, how can you make it funny? Now, but we'll try and keep it light as much as possible. One thing I want to say, you see that lovely picture on your screen. Now that is the coronavirus. And the problem I have is that it's too pretty. I mean, it looks like a Christmas tree ornament. It's gorgeous. And so every time it comes up on the screen, I go, oh, isn't that pretty? Now we need to change that. We need to, instead of making it look like this, why don't we show something horrible like this? Now to me, I mean, that is ugly. And that makes me think, ooh, I don't want that on me. I'm going to do anything that I have to in order to get rid of that, right? So anyway, so how are all of you surviving in this pandemic? You know, I can only guess the answers to that one, and I can only speak for myself and why it is especially hard for me because I am an extrovert. Now that doesn't mean that I'm outgoing. It just means that I need people. I need to be around people. That's where I get my creativity from. And that's where I like to interact and I like to communicate with people. And so this has been a little bit tough. Now I realize that some of you may be in isolation or in quarantine even by yourself. And I feel for you. I can't imagine what you must be going through and hoping that you're able throughout the day to connect, just as we're doing today, with other people in your life. Now, I know some of you are in isolation with very small children, and my heart really goes out to you. Our daughter-in-law posted a cry from the heart on Instagram last week, and what did she say? She said, the kids are going crazy. We're losing money by the minute, but now, any time of the day is cocktail time. So Now, all I've got in isolation is one hearing husband and 2 cats. And our cats are a little confused about this because normally we're traveling at this time and we're away a lot. And now that we're home with them every minute of the day, and when we walk into the kitchen, they think they're going to get fed every single minute of the day. So I already have one overweight cat who's actually big boned. It makes him look fat, but he's not. He just got big bone. And he's also on anxiety medication because when we traveled, he missed us. So he never liked whoever was house sitting. So he would sort of hose down their particular private, clothes and that sort of thing. Now I had a pretty busy spring planned. Like you, I had plans. I was going to do a lot of speaking engagements. I was going to go to, where was I going? Edmonton, New York, Ontario, and Budapest, Hungary. And that's not happening. So where do I go now? I go into the kitchen. I'm going to the living room. I'm upstairs in my office. I'm in the kitchen again. I'm always going into the kitchen. One of the things I found in this pandemic and surviving it, a lot of it seems to be around food. And I'm just getting sick of my own cooking. And I'm very excited because tonight, for the first time, we are going to have a pandemic type takeout. The local pizza place, you order it online, they get it ready. You drive up curbside and they come running out, presumably with gloves and masks, and give it to you through the car window. So I am so excited about having something different. In normal times, the hearing husband and I often go into Sydney. That's the little town near where we are. It's 3 kilometers away, which in American is about 2 miles. And we go in every day. Well, we did, and every day to shop, have coffee with friends, maybe visit the wine store, go for a walk. And now we can't do that anymore. They say, if you go out, you can go shopping, and you must buy, or they suggest that you get enough food for 2 weeks. They don't want you to hoard, but they want you to get supplies for 2 weeks. And so the first time I went shopping, I bought so much salad stuff, and somehow I'd forgotten that salad stuff doesn't last 2 weeks. So anyway, I can't tell you how much lettuce I had to throw out. People like to say that what we're going through is unprecedented. They can't remember a time like this. Of course they can't. We haven't been through this before. We're too young to have gone through the 1918 Spanish flu or the Black Death in the 1300s. But I don't want to make light of this because some of you may have come to Canada from war zones. You've been through crises, living through crises in political situations in other countries. So this is a very different crisis, but some of us have gone through, or some of you have gone through perhaps similar things. The worst I went through was back in the 1970s, a million years ago. I was living in Darwin, Australia, and this is what I woke up to on Christmas Day. It was a cyclone that completely flattened the town. And, but it was still only a week or 2 of my life, and then things went back to normal. And a big learning for me going through this pandemic, is realizing how complacent I had been about things in my life, how lucky I've been to be living in this country at this time. I mean, I'm a baby boomer, and sort of the generation where the economics kept getting better and better, and technology and all of these wonderful things. You get into a complacent spot and you think nothing bad's going to happen to my generation. We've got it all figured out. And in Canada, I mean, most of us haven't been affected by war, unlike most other countries in the world, in decades. So I guess Canadians, we have this little superior feeling that we very polite and we don't boast about. So this is a shock to have this happening now. And we have to go through this and have hearing loss? Yes. Pandemics like this don't play any favorites. Let me get beyond that. So, I call this, what is the worst part of distancing and isolation? Well, it's mostly bad. But we're going to talk about good stuff a little bit later on. But as people with hearing loss, we're used to isolation. We know all about it. For example, at a dinner party with other happy, chatty people, we can't follow the conversation, so we are isolated. If we don't, in a lecture or an event, if we don't understand the leader or the speaker because we don't have communication access, we are isolated. We are left out in the cold. I mean, the best we can do is sort of kind of keep our eye on the next guy and, copy him and hope that he's not keeping his eye on the next guy. But with hearing loss, we get isolation. The worst part, I guess, in isolation is, if you're on your own or with other people, but I'm in isolation with one other person. So that's the person that you really loved in January, and you really loved them for most of February, but here it is the end of March, and it's like you think to yourself, if you breathe like that one more time, I'm going to do violence. Or you think, really? This annoying thing that I've never seen you do, but apparently you do it all the time, and now that's all I see. You go crazy. So it's best to, if you can find a place to have your own private spot in wherever you're living, a little time apart is good. For me, one of the worst things is, or one of the things that bothers me is that I can't hug people. And I would love to be able to hug my 85-year-old neighbor, Ray, who had to take his wife to the hospital last week for a cancer operation. He had to drop her off and then not speak to her or see her for days. It's very frustrating. So, what have you done in your isolation? Have you been like some people who just scrub their house or their apartment from top to bottom and get everything spick and span? Well, I think Doug and I thought that we would do that. We were like, that chair we were going to cover? Or, that door we were going to paint? 2 weeks have gone by and our house looks exactly the same. The worst thing though, is masks. Oh, not the mask, anything but the masks. Oh man, of all the global crises that the master of the universe could send down, it's this one, the one where people wear masks. I mean, it's the absolute worst piece of clothing that someone could wear. It's worse than, did you see that movie Bird Box? It was Sandra Bullock, where they had to wear blindfolds so that they couldn't see the creatures and bad things would happen. I mean, I remember thinking, oh, I couldn't do blindfolds. I wouldn't be able to read lips. I couldn't understand. Well, masks are even worse. Why can't it be some pandemic that we could just put gloves on and it would be better? But there are things going on behind those masks, and people with hearing loss, have trouble figuring that out. I mean, who can speech read a mask from 6 feet away? And they're talking to you because A, their eyes are on you. Secondly, the mask is moving. Thirdly, their hands are moving around. Their eyebrows are going up and down, and you can hear sounds coming from behind that mask that you assume are words. But what words? What is the person saying? So if you say pardon, the mask just moves faster and the words come out louder. This does not help. We can be forgiven for saying something like, I am sorry, but I have hearing loss and I can't understand you. Do you need help? Well, if you do, could you ask someone else? Or could you write it down maybe and I'll try and read it from like 6 feet away? Or I won't tell anyone if you don't. If you could just lower your mask just a bit and mouth the words without spraying any spit. Otherwise, I'm just going to have to say, have a nice day and stay safe. Now, the reality is that we have to interact these days with people who are wearing masks. And as you can see in this very high-tech diagram that I did myself, you need help. People aren't going to lower their masks. They are wearing them for a reason. So between you and that masked person, you need a translator. Now the translator can be either a person or it can be a device. Now, I have a very well-trained hearing husband. And if someone says something to me and I don't get it, I can just flick my eyes up to him and he will step in and he will translate. Unfortunately, he also tends to answer the question as well. So it's something that we continue to work on. But another good thing, I'm sure some of you have found it, it is a speech to text app that you can get on your phone. Now this is, hang on. This is Otter. So if you can see there, you'll see the words coming out. Speech to text devices are much, they're more able than us. They don't need to read lips. They can understand through masks. And there are many different types of these apps. Live Transcribe, Ava. I happen to use Otter, O-T-T-E-R. But if you don't have this, I would suggest, and even the hearing people out there, this is a good thing to have on your phone if you're talking with someone who has hearing loss, because it can help them with some of the words. So I really, really recommend that. Now, conversely, if you are wearing a mask at some point during this pandemic, please speak clearly in the way that you would like people to speak to you. So what do the experts say? You know, our kids, our grown kids, really have been following the advice, and they got and listening to what the experts said early on. And one of the things they said was, you need to make sure that elderly people stay healthy. And apparently elderly has been redefined as anyone 60 years old and older. And that's the hearing husband and me, because we are over 60. But let's take a few minutes to just take a look at what the experts say. Number one is stay healthy. Now, I know you probably listened to this and read this, you know, ad nauseum, but it's really, really important. It's important to stay healthy. And how do we do that? Well, we need to stay isolated and socially, physically distant. I think that's what Chris said. I know that in BC, our chief medical officer, Dr. Bonnie Henry, has said over the last few days that she's very encouraged, that she thinks that our distancing and our isolation is actually showing some results. And so this is the best possible news you can hear in a sea of bad news. So continue doing that. It's really important to eat well and at regular times. Routine is good. Our lives have been turned upside down and it's crazy, but having some routine will help us get through the day. We need to eat well, as well as possible, and fresh foods and that sort of thing. Wine is allowed. Also, exercise. Today in Canada, I believe that there's been some clearer guidelines given as to if you want to go out for a walk. And there was all sorts of confusion about that. And we had some neighbor who was threatening to report us because we were out for a walk. You can go outside for a walk if you do not have COVID-19. I heard Chris say that. I thought you pronounced it COVID. I call it COVID. If you don't have it, and if you're not showing any symptoms, then you are free to go out for a walk. Inside, exercise as much as possible. What's also really important is do not obsess on the news. If you listen to bad news all day long and it's the same news over and over, it's really going to have an effect on you. So try not to obsess. Get plenty of rest, just like you normally do. And what's really important is to be productive. And we're going to talk a bit more later about what that means to be productive, to have some accomplishments that help you get through the day. And also stay connected like we're doing now. I think people are finding all sorts of ways to connect. A lot of museums, Broadway, I think it's either in London, England, or on Broadway, they're live streaming Broadway shows. There's all sorts of things that you can do. Of course, and there's Netflix and all of that. But stay connected with your friends and family. I want to talk about mental health guidelines. The Canadian Mental Health Association has a 5 key points that they want to stress with people. If you are anxious and upset, and I think, well, I can only speak for myself. I know that this is getting to me and that I have moments of anxiety. Recognize that you are anxious, recognize that you are upset, and then you can deal with that. And know that everyone else is going through this as well. Take care of yourself. The points that I made up at the top here, they're very similar. And it just drives home the necessity of knowing this stuff. Take care of yourself. The best thing that we can do as individuals to help this whole pandemic, get rid of it, is to take care of ourselves so that we don't make anyone else sick. Limit the coverage, limit the news. Another point I wanted to make on that, it's really important to get your news from a source that you trust, where the health experts, the scientists, these are the people that we want to be listening to, not politicians. Focus on factors that we can control. You can't create the vaccine. You're not going to be, putting people on ventilators, but what can you do is keep yourself healthy, wash your hands, and some other ideas of things of how you can help other people, but just focus on what we can do. And if you are feeling that it's just too much, reach out for help. On your screens on TV, you will find there'll be numbers to call. And you can look up your local mental health association and look up contact information, okay? So we need to get this out of the way. I hope that none of us get sick. But should you get sick, it's really important to follow the guidelines that are in your area. On the TV all the time, it will tell you, do not go to the hospital if you feel sick. Stay at home and then call your doctor or call the local health clinic and tell them you've got the symptoms, what you should do. Then they will tell you what to do. In the meantime, the person with hearing loss, it's really important to have a communication plan. You have all your communication devices ready. Now, most of us, when we have we've got our phones, we've got our hearing aids, our cochlear implants, batteries, paper and pen. These are all things that you might want to pull together in the event that you're sick and you have to go to the hospital. Understand that should you be at the clinic or hospital, you may lose access to your favorite translator, which would be your partner or a family member. So it's crucial that we self-identify and let health personnel know that we have hearing loss. And we also have to understand that they are not going to lower their masks for us. So we have to find a way to communicate, again, through your speech to text app, or even pen and paper, and some written signs that will say, hi, I have hearing loss. So, where am I? So are you stopped? How are you getting through this? Have you got everything you need, a pandemic inventory? We may think we're great planners and great shoppers, but this whole pandemic has taught us a few things. When it first started really getting serious, the hearing husband and I were still in the United States, and we were with friends in Palm Springs, and we were watching the news of entire Costco warehouses being cleared out of toilet paper. This hoarding frenzy of toilet paper set in, and people were leaving the warehouse with their carts stacked with toilet paper. And I'm going, wait a minute here. Is there a gastrointestinal aspect to this COVID? I mean, is this virus going to be having us sit on the john for hours every day? I couldn't understand why people are filling their carts with toilet paper. I still don't. I mean, if I had one cart to fill, it wouldn't be toilet paper. It would be chip and dip, cheap wine, salad greens, whatever, not toilet paper. So again, we talked about it earlier. They want you to not hoard, but stock up for a couple of weeks at a time. People with hearing loss, what do we need? Have you got enough batteries? Batteries are the most important thing. Oh, shoot, hang on a sec. What did I do?
Gail, just backspace.
I know what I did. I'm just trying to get it. Now I have to go into slideshow. I knew something like this was going to happen. Third slide, and I'm going to go back. I solved my own problem, aren't I? Wonderful. Okay. What people with hearing loss need are batteries. I am a battery operated person. If I don't have batteries, I just kind of go, woo, 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 woo. So I'm stopped. I always have plenty of batteries. Back in the day when I smoked, for example, I would never leave home unless I check, I've got 3 or 4 cigarettes. I never leave home without my hearing aid batteries or my cochlear implant batteries, even if I go on a hike, because I don't want to go deaf on a hike. You don't hear what's rustling in the bushes. Now, what else do you need? So what I did, I got home from the States and found that I didn't have enough batteries. So I called Mr. Amazon. Yes, Chris?
Can you just hold on a second? The captioning stopped.
The captioning stopped?
So you'll want to go back to, when the captioning resumes, you'll want to go back to going out hiking. But just hold on a second. The captioning is not, it's stopped.
But it's not back yet, is it? The captioning?
Just hold on, okay?
Okay, so back to hiking?
Yeah.
I still don't see the caption. Keep going. Okay, all I was saying about,
Not yet, not yet.
I'm not sure if you guys can see Chris, but I've got the God here telling me to not talk. If you want me to talk, Chris, I need to see your face again and say, talk, Gail.
Yes, I'll do that in a moment. I'm just,
Okay,
I'll let you know when to resume.
okay.
get some water. Sorry, the captioning is working again.
Wonderful.
Sorry about that.
Well, that's okay. And it gives everybody a break from listening to me for a moment or two. I was back at hiking saying that I always have batteries. And I contacted Amazon when I got home, and I have enough batteries to last through a couple of pandemics. I have 2 different types of hearing aids, a cochlear implant, so I need lots of batteries. But also you need things like your wax guards, and I hope you all change your wax guards regularly. And the reason I said that, is that a friend recently, we were together and she said something that she wasn't hearing her hearing aids weren't hearing well. And I changed her wax guard and she almost went through the roof. She hadn't ever changed a wax guard. So you need your wax guard, your microphone protectors for your cochlear implant. All of these things can be ordered through your provider or through Amazon. And you might also go back to what we talked about, the hospital. This is just my go bag. I have all my equipment in here with batteries always on hand so that we're fully prepared. When did it? Okay. Oh, I wanted to say something about talking about wine, and that there was a bit of a panic when they thought that liquor stores were going to have to close because they weren't essential stores. And so someone sent me this on Facebook. I just wanted to caption it. You don't have to do this, but heard a doctor on TV say that to get through the boredom of being in isolation, we should finish things that we start and thus help create more calm inner lives. So I looked through the house to find all the things that I'd started, but I hadn't finished. I found some things. I finished off a bottle of Merlot, a bottle of Chardonnay, a bottle of Jack Daniels, a bottle of rum, and the remainder of a Valamum Skiption, and a box of chocolates. You have no idea how fucking fabulous I feel right now. So you forward this to everybody you know who needs inner peace and tell them you love them. I'm sorry, I couldn't resist that. I thought it was so funny. So, what do I want to talk about now? Oh, man. I'm sure this isn't looking good. Chris, is it still okay?
It's looking great, Gail.
Okay, so we're talking about batteries, etc. I do want to talk about getting hearing help because a pandemic does not stop our need to have access to hearing help. And I got this from my provider, Erin Wright. She's an audiologist in Victoria, from her website. And from what I understand, many hearing care professionals and clinics are offering similar services. One is telehealth. You can use the phone to make an appointment. Curbside service, if you need supplies or hearing aids, you can call them from the parking lot. Staff will come to your car. Or if you have sudden emergency services, sudden problems with your hearing, you can contact them. And if you have sudden hearing loss or your hearing aid completely blanks out, they may arrange for someone to come and see you. So we really need to be able to survive isolation by going, not to do the extreme, where we're freaking out, where we're like, oh my God, this is it, the sky is falling, our leaders are crazy, it's all caused by bats, I'm washing my hand to the bone, and yet other people don't even care, like that guy riding along with his mouth open and all that infected bit hitting everyone, or to Miss Perfect, who's totally obsessed on being perfect. We need to find that balance to get through. And it means doing things for ourselves and for others. So I mentioned this before, be productive. What does that mean to you? I mean, it could mean that you do get to finish, recover that chair you wanted to do, that you do clean up the house, or you do something that you say you've been waiting for when you had time. Read more books, learn some sign language. It's important to find calming activities that don't involve a screen. Get outside, find new recipes, and use connection. Like in our family, we've started playing the game Catan online. And so we have FaceTime, so we can see all our kids all around the continent, and we play the game together. And that's been so helpful, because when you can't hug the people you love, at least you're hearing their voice and you're seeing them. And what's really also important is, if you want to do something helpful for other people with hearing loss, do go on to social media and look at some of the groups on Facebook, on LinkedIn, and reach out to other HOs, people with hearing loss, on social media. And you're going to find there a lot of people who are frightened and upset and struggling with their tinnitus or their hearing loss. You can reach out and you can spend some time and share what you're going through. And I can't tell you what a difference that makes for other people. We live in an area where there's a lot of townhomes. We live in the woods, so some of us are doing shopping for each other, sharing puzzles. And every night, a lot of us, we go out onto our decks and we make some noise. I'm sure you've seen this on the news. It's 7:30 back east, it's 7 o'clock out here, but we get out and we bang pots to pay tribute to all the people on the front line, people who are risking their lives for us. And personally, I'm going to be doing that every day until this thing goes away. If there's a way that you can volunteer in your community to do it safely, just keep your eye on the news, that there might be opportunities for ways that you can help and sort of get you out of your own head and out there helping other people. Yes, you know, this pandemic, this coronavirus is highly contagious, but so is kindness, patience, love, enthusiasm, and a positive attitude. Don't wait to catch it from others. Be a carrier. I want to thank Canadian Hard of Hearing Association for letting me rattle on and take what I hope has been a slightly lighter look at what we're going through. CHA, the Canadian Hard of Hearing Association, has been part of my life for 25 years. And for many of us and similar organizations in other countries, such as the Hearing Loss Association of America, it keeps us connected. This computer and technology is keeping us connected. And I want to thank you for the opportunity to be able to connect with you today. Thank you very much.
Well, thank you, Gail, for being our first guest webinar speaker for our Living with Hearing Loss series. We've been having a number of these over the last couple of years, but as I mentioned at the beginning of the webinar, this is something we're going to continue to do in the weeks to come to make sure that people who are practicing physical distancing, as I like to call it, are able to connect with other HOs, as you like to call us, to be able to connect during this very difficult time. If you haven't yet, please send your questions to events@cha.ca or send it here in the chat box and we'll answer those. We do have a couple of questions that have come in. So if you won't mind, Gail, I'm just going to present them to you now and you can answer them if you don't mind. So one of the thing that was going on in the chat box, there was a lot of conversation about was some of the apps that you mentioned for speech to text. we don't promote any particular brand here at CHA, but do you want to talk about some of the apps that you use, or if there's a cost associated to them and such? I know I use some different apps, and but can you talk to some of that? You're muted right now. Do you want me to on? No, you're still muted. I'm unmuting you. Hold on. You're still muted.
Okay, how about that?
Thank you. That's
Okay.
great.
So my apologies. I am having some tech issues basically because I touched a few things and my screen looks very odd. I believe you asked me about what speech to text apps. Is that what you said, Chris? Okay, I think I mentioned the.
Yes, that's correct. Can you perhaps talk about some of the speech to text apps that you were mentioning that people may want to use if they need to go to the hospital to seek treatment and so forth?
Okay. I believe I mentioned them, but I'll say them slower. The first one that I use is Otter, O-T-T-E-R, and it can be on both Android or Apple phones. And if you're able to look in the chat room, some other ones have been mentioned there. Microsoft Live is a good one. Live Transcribe Live. Oh, my screen's going crazy.
That meeting I was telling you about that was going to be on.
Okay,
Gail
I
Hannan.
think I have been cut out. Somebody has gone onto my screen, has taken it over. So I am going to put this back to Chris because I'm not really comfortable continuing to speak at the moment, and I apologize. So Chris, I'm turning it back to you.
Have you had your lunch?
Thank you, Gail. I'm actually not sure what happened there. So I apologize for that.
I'm okay now. Yeah.
There's been a lot of discussion going in the chats. Someone just talked about a wax guard. Can you explain what that might be?
I can. A wax guard is on your hearing aid at the very end where the technology, there's something, it keeps the wax from going down into your hearing aid. So there are different wax guards for different types of hearing aids. So, okay, so it comes out. If you wear hearing aids, then you most likely need a wax guard unless it's the very newest kind. Your audiologist will tell you if you need ones. Sometimes audiologists change them when you go to see them, but people should be using them as well. It protects your hearing aid from damage from wax getting into it.
Thank you for that, Gail. The other question I would probably ask is, actually, I'm going to make a comment to something you said. You suggested that people go on to Amazon to order batteries and so forth. I'll just make a note that yesterday I was trying to order some stuff on Amazon myself, and they're actually now trying to restrict they're putting things in priority. So a number of things won't be able to be delivered until May at this time. So I highly encourage you, if you're having those encounters, do connect with your hearing care provider, and they may be able to offer some of the curbside programs that Gail mentioned, or even ship them to you or whatnot. But it is a very interesting time that we're living in. Again, I want to remind everyone that today, this webinar, it's something that we've been trying to do on a regular basis. And we want to continue doing these to keep you connected in the weeks and probably a couple of months to come. So if you have any ideas of people or topics you'd like to see, please send that to events@chaw.ca. We'll also send out a survey at the end of our session to let you provide feedback and also to be able to make any suggestions with any future speakers. I'd like to once again thank you, Gail, for this presentation. It was extremely informative, and I know that many of us could relate to this, and was on a lighter side, which was really nice because the news has been pretty heavy, and I think the way we've come together today was very helpful. I'd also like to say thank you to everyone that's joined us today. It's important to stay connected, and throughout this event and today, let's practice good physical distancing and be kind to one another. And I'd also like to thank all the frontline people that are working on the lines to keep us protected and safe. We have people on this call that are actually nurses and audiologists and so forth. So thank you for all your service that you're doing, and thank you everyone for joining us today. Have a great day. Thank you.